Guys, do you hear me, guys?
Yes, yes.
Yes.
Yes, my everyone
Yes.
here.
Everyone here, right? Okay,
Yes.
Yes.
Yes,
Yes.
yes.
okay.
Yes,
Uh,
Mighty.
okay, so we start first with the monocular disorder cases that is assigned to us. So, okay, firstly, I would like, Alia, can you show the case study here?
Right. Let me see.
Yeah. Okay, guys. Do you all see the screen?
Huh?
Do you guys see the screen right now?
Oh,
Yeah.
yes.
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 Yes, yes.
Okay,
Yes.
without
Very
further,
good.
without further ado, we start the discussion right now. Okay, so the case is about the 20 years old Malay female that never wearing any spectacle, and the mother noticed that her eyes turn in since the age of the 6 months, and
Mm-hmm.
so was diagnosed with the congenital dystrophy at the age of 5 years old. So so I would like to give some explanation about the third and the fourth statement just now. Okay, so it is normal for the newborn baby to have their eyes to cross occasionally during the first few months of life, but it will recover and become straightened out when the baby achieve the 4 to 6 month old. So if the eyes does not able to straight out, the baby has a term called strabismus. So okay, so hyperthyroidistomia is a ocular motility disorder in which there is inward turning of the eye or of the eye, and the angle of the deviation is constant and large, which is more than 30 prism diopter. So usually, the condition which is this congenital dystrophy usually can be diagnosed at the age of 1 to 4 years old. But based on this case, the condition has been only been diagnosed when the patient achieved the 5 years old. So the diagnosis been done a little bit late. Okay, so
Okay.
so for my opinion, it due to the fact that the diagnosis has been done a little bit late, it may interfere with the development of the child. Okay,
Mm, I
Mm-mm.
see.
Mm-mm.
okay,
Okay.
okay. Do you guys have anything to ask about this congenital esophagia?
Mm.
Maybe
Yes,
up to which age that the isotropia is normal in baby
in baby.
uh, that you explained earlier.
Uh-uh.
Okay, okay. I said just now that the diagnosis of the congenital esophagia can usually is been made when the baby achieve from 1 years old to the 4 years old. But based on this case, the diagnosis only has been done when the patient achieve 5 years old of age. So it's a 1 year little bit.
Oh, late.
Yes.
Lead.
So that
Oh,
may
okay.
interfere with the growth development. Okay.
Oh. Oh.
Okay.
Okay, okay.
So do you guys have any
Paham, paham.
question? No.
Hmm.
I think
Okay,
I
okay.
understand it very well.
Yeah. So I think okay, I passed the presentation to Alia to explain more the detail about the case. Okay.
Um, I think okay, thank you, Maidi. I think there are more information that
Alia,
sorry.
you're not so clear.
Your sound is not
Uh,
clear.
we
Okay.
cannot hear you very clearly.
Hello. Lanjut. Okay. Um Yeah. Okay, Maidi, thank you. I think there are more information that is relevant in determining the binocular vision status. Okay, she had eye patches only between age 5 years to 8 years old. This means that during preschool and school age, she wears eye patch as part of the treatment of strabismus.
Mm.
Yeah.
Alia,
Yes, yes.
Alia,
Yes.
can you explain more how the eye patch can help this patient?
Okay, by occluding the stronger eye with the eye patch, it will force the brain to use the weaker eye to improve the vision clarity and encourage the use of both eyes together. As Maiti has explained, the
Okay.
congenital esotropia, the
Okay.
babies with congenital esotropia have strabismus.
Oh, Ah,
Oh.
Yes.
Mm.
okay.
Okay, next, she also underwent medial rectus resection surgery at age of 9 years old for congenital esotropia treatment.
Mm. Alia,
Yes, yes.
what is the medial rectus recession surgery about?
Oh, the medial rectus resection surgery is a measured retroplacement of the muscle from its original insertion. It is the most effective way of weakening the medial rectus and is most commonly performed procedure in strabismus management.
Mm.
Oh,
I
But
see.
but if but if she had this surgery at 9 years old, so I think like how does the her age affects the surgery?
Oh, okay. As she does not correct the esotropia before 2 years of age, there is low chance of developing the ability to use both eyes together, which is we refer to binocularity, and the
but
chance is diminished with age. Okay.
Mm.
The complication of the surgery for this patient case, the patient has incidence of overcorrection following medial rectus resection surgery as she complained the left eye is drifting out over time.
Oh.
Mm.
Besides that, she has a good health systemically and neurologically from birth until now. Means that she did not take any medication that can affect her eyes or any pathological diseases and disorders. Here, I think there might be problem with her refractive error or the motor and sensory function in the development of binocular vision.
Okay.
Okay, next, for the chief complaint, it is gradual exodeviation in left eye. She complains that the left eye is drifting out over time.
Mm.
okay.
Okay.
I think that's all.
Understand.
Acceptable.
Okay.
Okay.
I
Understand.
understand.
Does it mean overtime is constant?
I think I gradual.
Overtime is gradual.
Over time is gradual. Yes, yes.
Yes.
It is constant exodeviation, right?
Mm.
Yes, yes. So
Yeah.
it is
Okay.
exotropia lah. Okay, okay.
Oh, man.
Makes sense.
Okay,
Okay.
is it finished for the first question?
Hmm.
Yeah.
Yeah,
I think so.
I
Yeah, I think we can move to the next question. Okay.
What's the next question?
Scroll it down, scroll it down. Scroll it down the question.
Wow.
Uh,
Okay.
yes.
Mm.
Okay, so justify why each of the information is important for the clinical analysis, right? Okay, guys, so why do you think that each of the information included in this clinical analysis is important?
Um,
Wait, Maidi.
maybe.
I
Yeah.
think we didn't discuss about
Yeah.
the findings, the abnormal
Absent.
findings.
Yes.
Abnormal
Oh
finding.
yes.
Ah,
We need to
I think
discuss
we
this
haven't
first.
discussed
Yeah.
about.
Maybe don't skip.
I think we can discuss about this a little bit.
Yes.
Anyone
Yeah.
to start?
Start with
Um,
unaided VA.
Okay,
yes.
for the clinical finding, I got some idea about it, but before that, there are some things that I would like to clarify with my. So, might be about the congenital cataract that you mentioned before. How does it affect the vision of the patient?
Okay, so for that question, how the congenital esotropia can affect the patient observation is when the brain of the patient favor one eye, which is the one that does not move inward. So the condition may lead to amblyopia or lazy eyes, which is reduction of VA with the absence of the pathological cases. So, with the reduction of the VA in the weaker eye, or the lazy eye, it will cause the interference of the binocular vision of the patient.
Okay.
Okay, see.
Oh.
Okay,
Hmm.
Okay.
okay. Now about the clinical findings. About on the unaided VA, we can see that on the right eye, it is actually
Good.
we can
Yeah.
consider normal 6.5,
Yes.
so
Yes.
it's still considered normal.
Yes.
And on the fogging test, the patient got the VA of 612, and that is a reduction of about 4 lines, so that is
Yeah.
still
As per
normal.
Normal.
And for the left eye, we can see that there are problems, which is the VA is 618 and no improvement with age. That might indicate a pathological problem.
Yes.
So,
Pathology.
are you? So, do you guys think it is true regarding the
Yes.
yeah.
pathological problem?
Yes.
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 Yes,
It is
I
a
agree.
pathological. I also agree.
Usually, no improvement means pathological problem. Yeah.
It also
Yes.
may can cause the amblyopia, right?
Ah,
Oh.
yes.
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 Yeah.
Yeah.
Sleep
Yes.
suppression, right?
Amblyopia. Mm-mm.
Yeah.
True. True.
Next. Next.
Okay.
So for the
After
cover.
that, wait. There is one more about the subjective reflection. Okay. Actually, on the right eye, the patient has a little bit of power, which is plus 5 diopter, and the patient managed to get 6 So I guess on the right eye of the patient, there is no problem with it. But
Yes.
on the left
Normal.
eye, it got a little bit of power. But at the same time, after subjective reflection, also there is no improvement with the
No
pinhole.
improvement.
Mm.
The
So
visual
So
acuity
I
is also
I guess
maintained.
we can confirm that it has no relation to refractive
Reflective
problem.
error. Yes.
Yes. Yes. Mhm. Okay. Okay. Understand.
The test.
Okay,
What about
so for the cover test, it it is actually done to check either patient have misalignment or not. But after performing the cover test, it is found that the patient have large constant exotropia at distance and at near. Her eyes move outward and there are misalignment between her eyes. But supposedly the normal eyes should not have any misalignment. So to quantify the misalignment, prism cover test was done. At distance, the patient requires 25 prism diopter base in to align her eyes back to the normal position. But at near, the patient requires 30 prism diopter base in to align her eyes back to the normal position. It is abnormal because normal value for distance cover test is around 1 plus minus 1 esophoria, and for near 3 plus minus 3 esophoria.
For the cover test, is it for right eye or left eye?
I think for right eye.
Right eye?
Yes.
Left eye?
I think sorry. I think for left eye.
Left eye. Okay.
Left. It's the XT.
Sorry.
I suppose it's
Mm-mm.
No, it's
left
okay.
exotropia. Okay.
Okay. That is the ocular motor test, right?
Yeah.
Mm-mm.
Yeah.
From the ocular motor, it shows that the patient has left medial rectus under action.
Yes.
And then I guess me myself, my opinion is that this condition is caused by the surgery that the patient undergo, which we can see from the history, like the one Alia said before. The patient has
Media rectus
the
recession.
surgery that weaken
Yes.
yes.
Yeah.
That treatment has make the medial rectus become weaker, and I guess that is why the
Left
left
eye.
medial rectus become under action, and that will cause the exotropia.
Mm-mm.
So, do you guys have
Okay.
any other assumption other than that?
My opinion is the same as yours.
Yeah. I
Yes.
also think like
So,
that.
so
And
from
also we can use
isotropia, it becomes exotropia.
Oh
Yes.
yes, because of the
Okay.
medial rectus become weakened, and
Amira, can you repeat? I
then it
can't hear
cannot end up.
you.
Because of the medial resuscitation, what's that? Because of that, it becomes under action.
Uh-huh.
So, from
So,
isotropia, it becomes exotropia.
Yeah.
Yes. Yes.
Amazing.
I think so, Amira.
Okay, okay. I see.
Okay, so I will proceed with word for dot. Okay, we
Yeah.
can see. Okay, we can see here that this patient only see two red dots, right?
yes.
Yeah.
Yes.
Um, we can see here at both distance and near.
Yes.
Means she can perceive only two red dots. Which is from the Carlson. I found that if the patient can see two red dots, it means that she has suppressed on her left eye.
Left side. Yeah.
Uh,
Okay.
because
Yes,
uh,
that's correct.
just take a look at the subjective refraction. The left eye is not improved, right?
Yeah.
So from the beginning, we suspect that is something wrong with her left eye. Am I right?
Yes.
Yes.
Okay, so uh, okay, why we do word for dot here, because the indication of word for dot is that uh, when the stereopsis is not achieved, which is the indication for word for dot is when stereopsis is below than 40 seconds of up. It is also used in the differential diagnosis of unilateral decrease of VA. So uh, it is proof from the subjective refraction.
Mm-mm.
Wawa,
Yeah.
Wawa, can you explain how we perform the endostereopsis test?
TNO. If I'm not mistaken, the patient need to wear red green glass.
Yes.
Red green on her right eye and green on left eye. Am I right?
Yes.
Yes, 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 Wawa, but correct.
Uh, so the patient need to see the booklet at 40 centimeter, just like we do the stereo flight. And then from that, the patient need to look at the random dots and guess what is the object is like look like. So if she correct, so there is for the picture, what is the second of art? it depends on how big the picture is.
Oh. Oh, okay.
So from for that, she has abnormal finding and stereopsis also. The normal values for stereopsis is 20 to 25 second apart. But this patient cannot achieve any level of stereoacuity.
Even the gross one.
Yes.
Okay.
The ghost.
It is because there is a difference in right eye and left eye, which is this patient has unequal retinal image size
Oh,
between right eye and
okay.
left eye.
Oh, that may be the cause of the stereopsis. Apa
Fail.
ni?
Uh-uh.
Fail stereopsis, right? Oh, okay, okay. I
Yeah.
see.
Yes.
Okay.
I think that's all for the finding, clinical finding.
Mm-mm.
We can
Okay.
proceed with the question one.
Okay.
Anyone?
Okay. Also, for the first question is all finished, right?
Yeah.
Yeah.
Yes.
Okay. So we move on to the second question, which is justify why each piece of the information is important in the clinical analysis. So based on the clinical analysis just now, uh, why do you think each of the information included in this clinical analysis is important?
Okay. I'll try to answer. I'll try to answer that question. Okay.
Okay,
Okay.
Doreen.
First, can you hear me clearly?
Yes.
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 Okay,
Yes.
good. Okay.
Crisp.
Okay, first, similar to other clinical examination, okay, like usual, we have to first check the unaided VA of the patient, right? We do that, right?
Yes.
Yes. Yeah.
Okay. However, for this patient, we cannot assess or we cannot know the habitual VA of this patient because the patient, according to the patient history, the patient has never worn a spectacle before. Okay, but if the patient wears spectacle before this, then we have to check her habitual VA too, aside from unaided, meaning unaided and also habitual. And afterward, we also have to perform the subjective refraction to this patient. This is the purpose is to have the accurate endpoint for this patient's RX. That's for unaided
Okay.
VA and subjective RX. Okay.
Okay.
Mm, what about the cover test? Is there any information why cover test is important?
Oh,
I will answer this part.
okay.
Okay. So for the cover test, which is basically is to assess the patient binocular motor function or which is alignment or deviation of the eye. So as you can see from the patient history, which is she previously diagnosed with congenital esotropia, which is the eye is moved inward during childhood.
Yes.
So it is important for us to do the cover test to know whether the current patient position, the current alignment of the patient. So to
Mm-mm.
perform this cover test, we firstly will do the unilateral cover test, which is occlude the one eye and then observe the movement, which is this is used to indicate the patient have tropia, which is we use for this case. And then for the alternate cover test is when we cover both eyes while observing the movement of just uncovered eyes. So by doing this, we can measure the foria of the patient. But from this case, we only perform the unilateral cover test.
Oh, okay, okay. Thank you, Iza.
Welcome.
Um, okay, I have a question.
Okay.
Okay.
Okay, as we can see here,
Yeah.
why do we also have to do prism cover test for this patient? Is cover test is not sufficient enough?
Oh, okay. Okay, about this, okay, you should know that when we perform cover test, we
Mm-hmm.
only know, like what Izzah said before, we only know if the patient has deviation or not. Meaning we only know the presence of deviation, but we cannot
Mm-mm.
quantify. We cannot
Oh,
quantify the
Yes.
we cannot quantify the magnitude of deviation by simply doing the cover test only. Hence, we must do the prism cover test. So, actually, prism cover test has the same procedure as cover test, but only with the addition of prism. Okay, you know prism, right?
Prism.
mm-hmm.
Yes, like prism bar.
Yes. Yes.
Okay,
I
prism.
reason.
So angle
Okay,
prism.
so okay. The procedure is similar. We have to perform cover test while holding the prism in front of the deviated eye until the
Mm-mm.
misalignment is neutralized. Okay, you know neutralized, right? Mean no
No
movement.
No
movement.
Ah,
movement.
Yes.
good,
Wow.
Amira. Okay, so the magnitude of foria then can be determined depending on the amount of prism diopter required to neutralize the deviation.
Mm-mm.
Understand? Can you, Wawa?
Yeah, yes, I get it. Thank you,
Okay,
Nuri.
good. Okay, welcome.
Wait, I'm just curious, why it is
Hmm?
important to perform ocular motility test for this patient? The
Mm, OMT, right?
for MTS.
Oh,
Yeah.
OMT.
Yes,
Okay.
OMT. Okay, basically for OMT is to assess the which is same which is for the cover test, but have with addition of the to assess the eye position and also the movement. So as we observe the action of all the patient eyes muscle when he look at primary gaze, which is at primary gaze is
Mm-mm.
using the Hitchcock test. So the patient previously underwent the medial resection surgery. So by doing this, we are able to detect if there are any change with the medial rectus as well as others muscle which is the seat muscle for both eyes. So from the nine position of gaze we choose the H broad test.
Oh,
Mm.
okay. So we want to know if there is any problem with the
The muscle
OEM
move.
lah.
Yes.
Mm.
Understand?
Okay. Okay, then what about the Warfodot and stereopsis test? Are both tests are important?
Oh, yes, yes. This definitely important. You have to listen,
Very.
okay?
Oh,
Uh,
okay.
because okay. I'll explain what this. Okay, we use for that test because we want to determine whether this patient has any eye suppression or not. Okay, you know that, right? Okay, so
Yeah.
if the patient can see all four dots, or all four dots, meaning he has no suppression. Okay, but if he can see three green dots, meaning he has right eye suppression. Am I right? I,
Mm-hmm.
I'm
Yes.
not
Yes,
mistaken.
yes,
Yes.
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 Okay, but in this case, as what Wawa said before, the patient can only can only see two red dots. Okay, so this indicates that the patient has left eye suppression. Okay, other than that, the position of the dot also is important. Other than the number of dot, the position of the dot also is important. Okay, because if the patient see three dots on the left and two dots on the right, meaning five dots, meaning that the patient has ISO deviation or uncrossed deviation. But if the patient see op- the opposite, meaning three dots on the right and two dots on the left, this indicate that the patient has cross deviation or exo deviation. Okay. Ah. Mm. Okay.
Okay.
That's what
Um,
dot is.
Okay,
Mm.
for next for strepsis. Okay, so usually we
Mm-hmm.
use strepsis to assess the depth of or the percent or degree of depth perception for true patient ability to fuse the stereoscopic target. So the type of strapsis that we use is random dot, which is this random dot. Um, which is the most accurate for acuity test. Therefore, but due to the advantage of this TNO, so it will detect the highest sensitivity of embryo and also the strabismus compared to other stereo acuity. Okay, so same that stereo acuity is needed for strepsis. So without presence of stereo acuity, which is reduce of VA, so that means there is no strepsis. Okay,
Mm.
Oh,
Yes.
that's all
okay.
for strepsis.
Thank you, Iza and Nurin.
Welcome.
Yes.
Mm.
Um.
Okay, is it all for the second question?
I think so.
I think,
I
yeah, I
think.
think that's it.
Okay,
Do
okay,
you guys have any question?
No. I have no
I
question.
think the
Okay,
explanation
good.
was very clear.
Okay, good.
okay, okay. If
Yeah.
there is no question left for the second question, okay, I think we can move to the third question. Okay, Wawa, can you scroll down to just see you at the third question?
Okay, okay. Number 3, right?
Okay, so for
Yeah.
the question, identify possible diagnosis of the eye deviation condition, including the sensory test status. So, anyone have any opinion? What might be the diagnosis?
Hello, can you guys hear my voice?
Yes,
Yes.
yes,
Yes.
Nina.
Okay,
Is that
so
you, Nina?
in my opinion, the possible diagnosis of this patient is having constant esotropia, obviously on his left eye. So the
Yes.
reason why, because it is already stated in the case history that the patient has been diagnosed with the congenital esotropia at the age of 5 years. Okay,
Yes.
and she
Yes.
already underwent the medial rectus recession surgery at the age of 9 years. So from these statements, when we think supposedly, we can assume that basically this patient should have a good prognosis, right?
Yes,
Supposedly the
yes.
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 tropia might
Good
not
pronunciation.
appear. Yes, supposedly the tropia might not appear anymore, but still the main complaint of this patient is actually she noticed that the left eye has drifted out over time. So this patient is like I diagnosed earlier, this patient is having constant esotropia on his left eye. So this is actually due to the conditions that we call it as a consecutive exotropia.
Yes,
Yes.
consecutive.
Ah.
Yes.
Okay.
Nina, Nina,
Yeah.
Nina,
Yes.
may I know what is consecutive exotropia?
Hmm.
Okay.
I
So
also
from
don't
my
know.
Okay, so from my
Yeah.
reading, next question, Fatin. So consecutive exotropia is a manifest exotropia that is developed either spontaneously or after optical or surgical treatment in a patients that are formerly had esotropia before. So, from what I have read, it has been reported in about 4% to 27% of the patients after the surgical treatments of esotropia. Am I answering your question?
Oh.
Yeah. Yeah, yes, Nina, thank you.
Okay,
Oh,
welcome.
I
Okay,
see.
so back to this case. Okay, so and also if you guys can have a look on the patient's clinical findings. So the patient have a very large deviations at azo
Mm.
at distance and near on her left eye, right? And the ocular
Yes.
Yes.
motility test also show under action of medial rectus. So meaning to say that this condition actually support that this patient actually having a constant exotropia when the it is logic, right? When the medial rectus is under action, so the eye will be deviate outwards, right?
Yes,
Yes.
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 Natural.
Okay. So
Yes.
So that is why I strongly believe that actually these patients, it can be diagnosed by having constant exotropia. So okay, other than that, does anyone have opinion on other diagnosis for this case?
Me,
I I
Huh?
want
yes.
yeah, I
Amelia,
just
go
want
ahead.
to ask,
Okay.
why do we choose the constant exotropia instead of consecutive exotropia?
From my understanding, consecutive exotropia is actually is referring to a condition, but still, when we try when we going to manage this patient, still the patient is having the same condition, which is large constant exotropia. So it doesn't matter. From my reading, from my understanding.
Yeah, okay. Proceed.
Okay. Understand.
Okay. Hello.
Yes.
Hello.
Okay. Thank you, Nina. I think your point was a good idea, a good diagnosis. But I would like to add on another
Yeah.
diagnosis for this patient. Okay, is that okay?
Okay.
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 Go ahead. Go
I
Okay.
ahead.
can't wait for
You,
it.
you you guys can hear me, right?
Yes.
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 Clearly.
Very, very clearly.
Okay, so from my reading, I see from my analysis, I can see the patient have a strabismic amblyopia. Okay, so maybe you're wondering why I say that this patient have a strabismic amblyopia, right? So I will
Yes, I wondered.
tell you more details about this condition. Okay, so Wawa, can you scroll up a little
Yes.
bit?
Until.
I want to see the box. The box.
Ah, yes.
Okay.
Okay. Can you see?
Okay.
Yes.
Okay. Everyone can see, yeah? Okay, so
Yeah.
Yeah.
I will go step by step to make it more clearer for you guys, okay?
Okay.
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 So the first one is for you can see from the table the unaided VA on right eye is 615 6.5 and it reduced to 6.12 with the plus one lens card with plus
Mm.
one lens. So which is it is indicate that the right eye is normal. But with the visual acuity in the left eye is 616 and it does not improve with the pinhole. So supposedly patient VA can improve to 6.6 but this patient failed to get
So,
6.6.
oh,
Okay,
oh,
so this is like we discussed before, like this might indicate that the refractive error she experienced may be due to the pathological problem.
Mm.
Okay,
mm,
okay, so and we can see from the cover test that she have a large constant exotropia on the left eye, which also known as a strabismus or misalignment of the eye. Okay. So when this is condition when the patient tries to fixate on the image, the fixated image on the left eye will fall on a non-foveal retina, which is the which the image will produce is the blur image. Okay, understand?
Yes.
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 Okay, okay. So and then this condition only happen on one left eye only, right? So we call this as a unilateral strabismus. Okay. And
Unilateral
I
Unilateral
strabismus.
unilateral
strabismus.
yes. So the
Unilateral.
unilateral is that okay?
Okay.
Okay.
Because only
So
happen kat one eye.
on one left eye.
Oh, okay.
Because the right eye is a normal eye because they got apa tu? She managed to get 6.6.
Mm.
So
Okay.
if because of this, it will transmit a different retinal image to the brain and causing the brain to suppress the information from the less focused eye. Okay, so then the responsiveness to input from the non-fixing eye reduced and eventually leads to visual suppression. Okay, visual suppression. To support this statement, the visual suppression, we can see from this patient recorded test. Okay, we can see
Product.
like two red dots only. So as
Yes.
Wawa mentioned earlier, that she has
Mm-mm.
suppression on the left eye.
Okay,
Yes, left eye.
because of this suppression and the result, the patient will only use the dominant eye, which is the right eye, to
Right.
fixate on the image.
Mm.
Right.
Mm-mm.
Yes.
Okay. So in addition, you can see here, we can see from this stereosis test also, it stated it that the patient cannot appreciate any level of stereo acuity. So this problem can arises because of the absence of bifoveal
Binocular
fixation
single
as
fixation.
Bifoveal
the
fixation.
shutdown of the left eye. Okay, because
Bifoveal
there's no
fixation.
yes, because there's no fusion from both eye.
No fusion.
No
Yeah,
fusion.
Oh,
yeah.
no
So
fusion. Okay. Understand.
the absence of bifoveal fixation is that the same as fusion of two image from the both eye.
Oh, the two eye
You-
cannot fuse image. Okay,
yeah,
understand.
Okay, I
exactly.
want to add for stereopsis, which is the TNO. Actually, they have two image, which is one image from eye is differ from the between the two eyes, which is when we use fusion, so that's only we can see the stereopsis. If there
Mm.
is separation, there is no image that we can see.
Oh,
Oh,
because of the NO.
Understand.
oh, then.
Okay, 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 okay.
Okay, understand.
Understand.
Alright.
So that is how I come up with the diagnosis that the patient have a recurrent strabismus amblyopia on her left eye. So maybe anyone want to add on more about this diagnosis?
No,
No,
Mm.
I
I
think
think
no.
So
that is complete.
It's
so
all
I
good.
yeah. So I think I can so I think I sorry. So I think I can conclude that the patient have a strabismus amblyopia and enlarged constant exotropia on the left eye. Do you guys
Yes,
agree?
yes.
Yep, totally agree with that.
Yeah.
Agree.
Agree.
Okay.
Agree.
Agree. Agree. Okay.
Okay,
Next.
is it all for the question 3?
I
Yes.
think yeah.
Yes.
Okay, guys.
Yes.
Okay, so for the question number 4, okay, do you guys have anything to say?
For the
Anyone?
Management.
well, what do
Management.
you think? What's the best management that we can give to this patient?
I want to this question. Can you guys hear me?
Yes.
Yes.
Yeah.
Yeah.
Yes.
Okay. Okay. Now, based on the clinical findings and complaint from the patient, also the diagnosis that just met by Nina, I suggest that for the short-term management, we can give the prescription for the distant vision on both eyes, as there are refractive error for subjective vision, which is the plus one adapter on both the eyes.
Mm.
The,
Oh, but Kila,
yes.
uh, why do you think you give the spectacle prescription? Because the patient did not complain about the blurred vision.
Uh-oh.
Okay. Based on what I have read, the first management to the patient with constant isotropia and also the strabismic amblyopia is to correct their refractive error if there is any present. However, they also may require additional, more complex treatments as visual therapy if the vision improve with the spectacle correction alone.
Mm.
Oh, so we need the spectacle correction because next we need to use it for the treatment.
Yes, right.
Mm.
Okay, I see.
Mm, may I ask, rather than prescribing correction to this patient, what else that can be done for the management?
So, I think
I want to add some on the prescription for the lens and frame selection. So we can use for the frame one, we can use a sturdy and lightweight frame, such as we all know plastic frames, and also
Plastic.
for the lens, plastic, easy and light, and it not easily broken, right? And then
Yes.
for the lens, we can use the durable lens, like usual, our CR39
Polycarb.
and polycarb also can, and we can use the anti-reflective coating. That's
Oh,
all I want to add.
it's like
Oh, understand?
I think we can also include advising the patient to wear the spectacle full time and advise her for visual hygiene, also good near work posture. And that can also advise patient to work in between while doing sustained new work.
Mm,
Do you think it's okay?
Okay.
Mm-mm. Okay, okay.
Understand?
Yes.
Okay. Um, I do have question. Can I know what are the long-term management that can be done to this patient?
For the long-term management, I think we should ask patient to come again in another 2 weeks to assess her vision performance with the prescription that we prescribe.
mm-mm. Yes,
That is a good idea.
Mm.
yes. Chris,
I agree.
Chris,
Yes.
what do you think for other management that can be done to this patient if the vision did still not improve with the prescription and to correct the constant exotropia condition? Is there any management, other management?
Well, I think we can ask the patient to come again in
Come again.
another 1 month after the adaptation
One
of the
month.
spectacle. Yeah, spectacle prescription for maybe we can do vision therapy for this patient. Give
Oh.
her vision therapy, which her eye will be patched for each season, maybe 2 to 6 hours daily, as this patient is an adult. So more than an is required lah to fix this problem, this condition, her eye condition.
So we can pick 6 hours like that. 6 hours
Yeah.
daily.
Mm.
Okay, I understand.
Oh, 6 hours. Okay.
So long.
Between that range lah. Mm.
Uh-uh.
Yes.
Do you there is other management that we can this
Other than the prescription and the other than the prescription and what after prescription?
Follow up.
After than that, we also can suggest for the referral to specialists. We can
Oh.
ask for surgery from the referral. We can ask the specialist to do the surgery for this patient. This is because we can do surgery to correct the consecutive exotropia or the the large constant exotropia. We
Let's
can correct
answer.
it
Yeah.
with the surgery. From what I have read, this exotropia may occur many years, even decades, right?
Yes.
Because of the after esotropia surgery. So, by doing this surgery, I think we can correct back the exotropia to the straight one.
I see. Okay. Good. Good.
Mm. Mira,
Mm-mm.
uh, does doing the surgery will improve vision for the patient vision?
Improvisation. Usually in adults, by doing this surgery, it does not improve. Actually, it does not improve the vision. We
Yes.
just want to look like pretty. We just want to make the eye appear straight, so that straight.
Oh,
It's not
okay.
like a
Oh,
line
Yeah.
outside the views.
cosmetic. For cosmetic purpose.
Yes.
Yeah,
Yeah,
nutrition only
experience.
for cosmetic purpose.
Oh.
Understand, understand.
Acceptable.
Um, Maybe we may opt for referral for surgery of the optometric management if the management does not help patient.
Yes.
Mm. Yes, yes, yes.
So we have
Understand, understand.
two management, right?
Mm-mm.
Two management. First is precision, and the next one is the referral.
So,
The vision therapy?
Vision therapy also.
Three, three.
Three. Mm-mm.
Three.
So
okay.
between the physiotherapy and the surgery, we will prefer more on the physiotherapy lah.
Mm.
Right.
Yeah.
Yeah.
Yes.
Mm.
Right.
I
Mm,
think that's all.
Mm-mm.
Mm.
I
So
think
we
we
have
have
finished
covered
our
all parts.
questions.
Yeah.
Yes.
I think we at the end of our discussion.
Yes.
yes.
So
Oh,
the diagnosis is what just now? The diagnosis? I forgot.
The diagnosis.
Conclude.
So we conclude so we come up with the what we call conclusion that the patient have the strabismus, amblyopia, and large exotropia on her left eye.
Left eye.
Okay, okay. Okay.
okay.
Okay.
Yeah,
And
yeah, that's all.
Okay, no one has any question, right?
No,
no.
No.
I think all clear.
Okay, all clear.
Mm-mm.
Very clear.
All clear.
Okay, so I think so we can end this discussion. Okay, so thank you for your participation for this discussion. Okay,
Thanks.
you have done a good job. Okay, so congratulations to everyone.
Okay. Thank you, everyone.
Okay.
Thank you.
Thank
Welcome.
you.
Bye.
Thank
Thank you,
you.
Thank
everyone.
you.
See you
Bye.
again.
You.
See
Okay.
See you
you.
next semester. Bye.
Bye. Take
Bye.
care.
Okay.